Hello, everyone. Thank you all for joining us today. Good morning, good afternoon, good evening to some of you, I'm sure. My name is Jefferson McMillan-Wilhoit, and I am the Chief Executive Officer of Flourish and Thrive Labs. I'm so happy to be here with you all today. Thank you all for joining us. We have got a really exciting time planned. You're going to hear from a whole bunch of our team about something really exciting that we're bringing to you today. But again, I just wanted to start off with thank you for being a public health professional. Thank you for the work that you do. Your work matters, you matter. And that in this season is something that we all share as public health professionals. So with that, I want everyone to think about something with me for a minute. If you're an early career person, or if you're mid-career or late career, I want you to go back and I want you to just close your eyes and I want you to think about why you chose public health. Why did you choose to get into this space that we're all in? Was it that you wanted to search PBS for 30 minutes to find a regulatory code or the grant requirements you were looking for? No? No one? Really? I didn't see any hands come up on that one. Well, then it had to be that you wanted to spend your weekends writing reports and answering emails and analyzing data and filling out grant paperwork and answering phone calls and all of the things that we have to do on the weekends. No? No one? No, I don't think so. That's not why I got into public health. That's not why any of us here at Flourish and Thrive got into public health. No, what got us into public health, and what I assume most of you got into public health for, was that you had this dream, right? You had this dream to protect your community, to prevent diseases, and to save lives, right? That's why we chose the profession that we did. But here's the thing, and I'm sure you're all feeling it because I'm feeling it. That dream got buried somewhere along the way, under an ocean of documentation, under endless compliance reports, entering the same data into 7 different systems because none of them want to talk to each other. Our dream got buried. And what did we do? We looked for something to help us stop drowning. And here's the thing. You're all drowning. We know that. And when you're drowning, you grab any life raft you can find. And what we're here to talk about today is this world of AI that has come to public health. And what happened is that AI appeared to be this life raft for us, and we all reached for it, right? We started using ChatGPT to write our work emails. We started using Grammarly to improve our reports that we send out to our stakeholders, whether it's our public or community organizations or our legislative counterparts. We use Copilot to handle those really silly Excel formulas and grant budgets that none of us can ever remember. We use free accounts and personal accounts and anything we can get our hands on, because when you're drowning, we don't care if the life raft is seaworthy. We're just going for whatever works, not because it's right or safe, but because that's the only way to survive. And that dream of changing the world through public health just felt like a luxury none of us could afford. You couldn't afford that. But here's the thing about life rafts. They just keep you, they don't actually get you anywhere. They leave you sitting in the water waiting for a bigger boat to show up. But what if instead of just keeping afloat, we could lower the water level? What if instead of just learning to stay afloat with a life raft, we could get the water to a point that we could just stand up and walk? So I want you to imagine something with me. Imagine it's Tuesday morning. You are your health department's restaurant inspector, and guess what? You have an inspection that you have to go to. So what happens on this Tuesday morning when that water level drops? When you can walk on dry land instead of just trying to float? Well, you walk into this restaurant and you spot something unusual. You ask a question. You ask it out loud like you were just talking to another colleague. Except There's no one else there but you and your phone. You do look just a bit crazy just talking to your phone. But 15 seconds later, you have the exact code citation you need. You have the education materials you need to help that restaurant owner understand what the violation is that you found and how to correct it. What does that mean? That 15 seconds just gained you 30 minutes. It gave you 30 minutes to teach that restaurant owner how to do things better. It gave you 30 minutes to become a partner with them and to educate them. And it gave you 30 minutes that actually changed outcomes. You get to do the work that you dreamed of because you got 30 minutes back. And this is just one violation in one restaurant inspection. Think about that time and time again, over and over, day after day. Those 30 minutes add up, right? Instead of taking 30 minutes to go search and find and fix, we're taking that 30 minutes over and over and over again to do the things that we dreamed of. And what we call this 30 minutes gain, the system that helps us do this to gain that 30 minutes, we call it ambient intelligence. It's an extension of us. It's all around us and it's ready to help. It's there for us when we need it the most, and it's there for us when we actually don't need it at all, or at least we don't think that we need it. Ambient intelligence is a new class of tools that we're really excited about, and we are super happy to bring those to you today. But here's the thing, this isn't a future. This isn't something that's just we're dreaming of. This is happening today. It's happening in Sauk County, Wisconsin. And don't just take my word for it. Here to tell us more about that is Dr. Jennifer Weitzel. Jennifer.
Thank you, Jefferson. Good morning, afternoon, evening. I'm Jennifer Weitzel, the Director for Public Health, Sauk County. We are located, as you can see on the map, in South Central in the great state of Wisconsin. We serve just over 65,000 permanent residents with a staff of 34, but we welcome over 5 million tourists to our county each year. We are known as the water park capital of the world. So I'm going to share with you our foray into using AI and just a little bit of background. So early 2024, we received a grant, and with a portion of that, we were looking to develop a metric for our performance management dashboard that could in some way quantify a social determinant of health impact on health outcomes. And we were able to hire a consultant to help us do some systems mapping around that and come up with that metric. And that consultant group was F&T Labs. And so that is really important. I wanted to share that because it was during that process and in the successful completion of that grant objective that I got to know the folks on your screen here with F&T Labs and understood their dedication and their very nuanced understanding of local public health. And so when Jefferson approached me in the middle of that other project to ask, would we be interested in exploring the use of AI in public health, I wasn't as hesitant as I might otherwise have been because I trusted the folks at F&T Labs implicitly. My AI literacy level was pretty low, so it really was a leap of faith, but one that I was eager to do, to be innovative and to potentially, reduce some of the workload of my staff. So we sat down as a team, we brainstormed using process mapping, and we were looking at areas of workflows and identified where we thought AI could really augment our work. And one of the opportunities that rose to the surface was in our environmental health division. We saw an opportunity when it came to referencing the Wisconsin Food Code, which is just this beast of a statute regulating licensed establishments. And it can be very time-consuming to have to try to cite the food code, particularly for our newer staff. So at the same time that we were exploring this, our county was developing a countywide AI policy. So I worked with our IT department and F&T Labs to make sure that the work that we were going to embark on was compliant with the countywide policy. And one of the key elements of the countywide policy is that we needed to be able to track and log all of our interactions with AI. So PH360 was a solution that really enabled us to do that. The logging capability was something that was really important in addition to being able to handle protected health information in a safe and secure way. So the results were, as Jefferson showed on a previous slide, our sanitarians are able to use the food code chatbot to ask a question of the food code, and it provides a citation and an answer. And we discovered that out of the gate, we had about 86% accuracy. And the discrepancy for those answers that weren't exactly right, we went back and looked, and actually they were technically right given what was stated in the food code. But there are a whole host of interpretive memos and additional guidance that makes interpreting the food code less black and white and more nuanced. And so that accounts for the discrepancies when it wasn't quite as accurate or quite the answer we were expecting. But the bottom line is what sometimes took over 30 minutes for our staff to do in terms of trying to rifle through this huge document now could be done at their fingertips in under 2 minutes. So PH360 really gave us that time back, and it allows us to focus really on the work that public health is designed to do, and that's the building relationships and doing the work that we do to keep our community healthy. And with that, I will turn it back over to you, Jefferson.
Thank you, Jennifer. And I just want to say the team at Sauk County was amazing as we were going through this process. It was, right, as Jennifer mentioned, AI was new, right? And the team trusted us as we embarked on this journey. And I love where we ended, right? That we have this smarter solution based on, we started off with an 86% effective, right? And so we got better at it. We put those memos in. It got better to interpret. It got better over time. And so I wanted to take you all on a similar journey of how we got here. How did we get Sauk County here, and how are we going to get you all here? Well, the first question that we had to ask ourselves was, is there a way to give all of us in public health ambient intelligence that just works, that's safe, that's compliant? Because what we realized and what we heard as we were talking to a whole bunch of people in health departments, and as we all experienced in our health departments, was oftentimes when you get a new technology, when you get a new tool, the answer is no, can't use it. Or you can use it, but you can't use it to put protected health information in. You can't use it to put personally identifiable information in. You can't use it to put your policies in. Well, that's all well and good, but you're hamstringing the tool, you're hamstringing the technology. So we started out with, could we find a way to say yes? Because we all need, like my toddlers, a place to say yes. We all need that yes space. And so that's what we did. We started off by coming up with the AI partner, right? The AI partner is your expert assistant, your regulations, your context. This isn't just an AI chat. This is backed up by high-level quality public health information and knowledge, custom tailored to public health practice that flows through 7 different layers of information before it gets to you in seconds. That way, the information that you see and get back from your AI partner is accurate, consistent, and reliable. We're putting it through security and authentication. We're doing document processing and what's called retrieval augmented generation, which means that it's getting your specific parts of the information that we have and the information that you curate. We're taking it through context management and conversation memory, and we are building the prompts and the behavior in the background. You don't need to be a prompt engineer. You don't need to be a context engineer. We've built that into our AI partner. It's taking a multi-modal orchestration approach, which means that it's not just hitting one model at a time, it's hitting multiple, and it's crossing over multiple engines to make sure that the answer has cross-reference reliability, and it's citing that for you. We have a citation engine that's built into that multi-model orchestration. And finally, the last layer is that analytics and compliance tracking that Jennifer talked about that was so important. When we think about things like records retention laws and that all of our AI chats can be potentially discoverable, our system actually is logging both who said what when, right? Who put what chat in and what did the system return. That also gives us the ability and the ability inside of this AI partner to see how it's performing and to make it better. So that's all well and good, right? But as you heard from Jennifer, we had to build this chatbot with them, right? We went through this process of building it. And what we realized was that there's absolutely no way that we at Flourish and Thrive Labs could build everyone their own chatbot. It wouldn't work. And we don't want to, right? That's not sustainable for public health. All of us here are former public health practitioners, and we believe so strongly that public health has to be able to do things on their own. You shouldn't have to rely on bringing in high-paid consultants every time you need to build a new chatbot. But you also shouldn't have to learn the technology of building a chatbot either. You shouldn't have to learn how to be a prompt engineer. You shouldn't have to learn how to be a context engineer, because guess what? You learned how to be a public health professional. That's what your job is. That's the dream that you had. So what we did is we developed what's called our innovation studio. This is where you build your AI partners. No code, no prompt engineering, just you and the English language. You get from not having something that's built for your workflow to having something that's built for you and your team in minutes, not months. We're talking about a next generation of ambient intelligence that allows you to build the workflows that you need, because as Nabu, who you'll hear from later, likes to say, if you've seen one health department, you've seen one health department, and that is so true. We provide the underpinnings, we provide the general knowledge, but we give you the ability inside of the Innovation Studio to be able to draft and create your own workflow systems without needing to know how to code. But this only gets us so far. If you create your own AI partners, how do you give it the local context? How do you give it your health department's context? The way that we do that is through a living library. It's your knowledge. It's alive and growing. It's curated by experts, right? We curate the underlying layer, but it grows with you. As you put more context into the system, it learns more about your processes and it drives more of your workflows. So 3 revolutionary tools: AI partner, innovation studio, and a living library. Now, these are not 3 separate tools that you would go out and have to go and use. This is one platform, and we call it Public Health 360 or PH360. And to show you this innovative tool, give us a demo. Over to you.
That would help, wouldn't it? Hi, folks. Yeah. I'm Nebu Kolancherry, and I'm super excited to show you all PH360 and how hopefully we can work together to improve your work experience and that of your community. So this is 360. I'm accessing it through a web browser, just full screen so that you can see it. Like Jefferson said, we have secure sign-in so that we can meet all the security requirements of your organization. The place I want to start with is what greets you on your screen, which is any chatbot or any tool that you have access to. And we'll go through the specialized tools in a second, but let's start with Maple, which is our chat interface. So I'm going to give it a prompt. This is most akin to what I imagine many of y'all are using AI for. So let's say this is a very common use case that we hear from our clients: help me draft social media posts. So I've asked to draft a Facebook post. for flu vaccine in seniors. You've seen some version of this before. I imagine that AI is good at making social media posts, among other things. AI is good at helping you with research, writing emails. So this is your standard interface to do all of that, which you do today. The key differences are this: A, supports your HIPAA compliance, and B, supports records retention policies. And so it is absolutely in line with your IT department's desires to not get in trouble. So that is Maple. You've seen this before. The other piece then is what Jefferson hinted at, which is the specialized knowledge for you. So that what that'll look like for the end user is a series of chatbots or assistants. We have a fab one for our demo here, and then the food code one, which is what I'm going to show you. So this is a version of the tool that Jennifer hinted at, which is for the food code. So I'm going to give it a prompt, and then let me explain to you what it's doing. So what I asked it was a use case that one of their inspectors shared with us, which is I was doing an inspection. I measured a temperature of 48 degrees Fahrenheit in a fridge, which stores TCS foods. Provide me a draft of the inspection report. So what it's doing here is not just taking that prompt and giving you what you want to see. It's actually taking that prompt, comparing it to the food code, analyzing what the violation is, classifying that violation, and then giving you an inspection report. And so let me walk you through how it's doing that. So it gives the violation details here. As you can see, it'll classify the violation and then continue to say what corrective actions need to be taken. And this is where we really think that AI can revolutionize public health, is expanding the imagination of what is possible to truly help you in your workflow every day and save you that time that Jefferson and Jennifer had mentioned. Now, with this, you can take this and, have it write an email to the restaurant owner, have it print it out. What we want to create is the environment for you to do your jobs easier and save your time. And that's what this does. And then the last thing I want to show you is this, which is our logging feature. Like Jefferson said, every chat is logged, and you can have that for any version of records retention or compliance with any of the tools that you have. Juliana, whenever you're ready, if I could get the slides back, that would be very helpful. So while Juliana's pulling up the slides, this is sort of how we envision PH360 helping you in terms of both the AI partner as well as that specialized knowledge for different workflows within your team. And so here's what I'd like to do then is I want to invite you to go back to that dream. I had the opportunity yesterday to be a guest lecturer at a Public Health 101 course. And I don't know if any of you have had the opportunity to do that or remember when you were sitting in your first Public Health 101 course and you see this excitement in the students' eyes. They're in that class because they want to change the world. They want to prevent disease, travel the world, do the global outbreak prevention and all that. And I want to invite you to come back and remember that feeling when you first decided on public health. Maybe you're sitting in that classroom. And like to echo what Jefferson said, I don't think many of us envisioned the current state of our public health workflows, which is unfortunately a lot of moving data from one PDF to another. And so ultimately, PH360 is not about the technology, it's about what it enables. It's about the impact that it creates when you have time to help people. And so what we want to focus on is not about AI, it's about really what you can do with it. So our hope is that you can use these tools to help a mom not get food poisoning because you had 30 extra minutes to educate the restaurant owner instead of searching for the food code. Or, the kid who could keep going to recess, could keep going to school because you caught the disease outbreak on, let's say, day 2 instead of week 2 and kept kids healthy and kept kids in school. And ultimately, I think all of us on this call have had that experience when you're there, still stuck at work on a Friday at 5:45, just wishing it was over. And it's about relieving that burden for you and your team, right? Jefferson talked about drowning. And our hope is that these tools can help that water level drop a little bit. And so for us, PH360 is revolutionary because it gives you back what matters most, which is time to be a public health professional. So our ask is simple. If you're a leader managing a team that's on this call, working at a public health department, invest in your team. Because when you invest in your staff's ability to do their best work, your entire community is what benefits. So here's how we do that. We have 2 tiers of licensing for PH360. The first is the basic license, which includes Maple, which is that AI interface that I showed you, as well as all the chatbots that we've built for you. The second is professional. which includes the chatbot or an assistant builder, which allows you to create your own chatbots because, like Jefferson said, you know your workflow best, and we want to empower you to do that. So it's this combination of licensing that we believe that will support you and your teams to help your community succeed. Now, you do see the prices on the screen, which is that they start at $24 per user per month for the basic license, as well as $36 per user per month for the professional license. And I want to emphasize start at. And the reason for that is a thing that we heard over and over again from our clients is that we need population-based pricing, and that's what the structure that we've had today. So this is the lowest tier pricing for the smallest health departments. And when I say small, I mean the size of the population that you serve. We really want this tool to be accessible to all counties of all sizes. And so for bigger counties, we have a standardized population multiplier that we apply to that price, and we'll be happy to share that with you. I want to say that both these license tiers include full security, compliance, and administrative oversight. And as far as procurement goes, we are on the NASPO Value Point contract, as well as a whole host of others that we know we've walked in your shoes. So we understand how hard procurement is, and we're here to help you. And so what I'd like to close with is this. I want to emphasize that PH360 is better life raft. What we're hoping for is to, those good days that you have at work where you know that you walked away making an impact, where you know you helped somebody, maybe it was a phone call. It's that moment that makes you smile when you're on your drive home. We create tools that help you love your job and create more of those days. When you go home knowing you protected your community, and ultimately when public health just feels like public health again, that's what we want to build with you. That could mean Monday mornings where you're not dreading a pile of paperwork, or conversations where you are not scrambling to find the right thing on a PDF to tell a person. Ideally, we create a future where you're leaving the office on time and going back to your families because you finished your work. And ultimately, create a healthy community. So our invitation to you is this: invest in your staff, invest in your teams, create improved health for your community. And our hope is that this can be one more arrow in your arsenal to provide better services and improve trust in your community and from your community in your health department. We don't see this as a software purchase. It's really an investment in your mission, in your team, and in your community's health. So with that, we'd be happy to take any questions. Jefferson, do you have anything to add?
Sorry, I was actually answering questions in the chat as we were going. No, I do not. Thank you all for being here. We'd love any questions you have. I know I've been trying to answer them as they've come in through the chat. For any of us, really, we're all very passionate about this. And I'm sure if you have any questions for Jennifer, I'm sure she'd be happy to answer questions too.
Yeah, so please, I'm monitoring the chat. If you have questions, we'd love to answer them. So I think one thing I want to just sort of call out that someone made a comment about is my county has more ordinances than the state food code, right? Like you have the additional things. Do we have the ability to just build a chatbot or to build a knowledge base that will recognize these when in use? And yes, absolutely. That's part of the power of this, is that we are building this in an adaptive format so that we are not creating the AI system. I mean, we're creating the back end, we're creating the PH360 system, but then it's AI for your health department by your health department. So Jefferson, I was just wondering if there's anything else there that you wanted to comment on.
Yeah, no, so the way that the system works is that each health department has their own yes space for PH360. Underlying everyone's yes space is a shared knowledge base. That's things that we curate, right? And we're curating some of the best evidence-based practices, whether that be from MMWR or WHO or the National FDA Food Code at all the different years. We're curating all of that into those knowledge bases. But that's not the end, right? Because we recognize that everyone has something different. And so inside of your yes space, you're going to be able to build on top of our knowledge base to build in your own context. And that's one of the tools that we have in there to make that really easy. That's that living library, recognizing that you don't need to learn about vector databases. You don't need to learn about all of those different things and how to engineer them. We've done that. We've done the hard part. All you need to do is think about, what do I need for my public health practice? What do I need to give this system to be contextualized to me? And it makes your life easier so that you can get back to the public health practice that you really love and enjoy.
Fantastic. Thanks so much. So we had a really great question in the chat about sort of understanding where PH360 fits within the bigger world of AI language. So would we classify PH360 as being an AI agent, or would we classify it as being something else? And Jefferson, I'm passing this question over to you.
Yeah, so we would actually not classify it in a world of AI as we think about it, right? Because normally when people are saying AI, they're thinking about artificial intelligence, whether that is traditional, what I would consider to be traditional AI, which is machine learning and data science, or even to this point, generative AI, which is your foundational models like Claude or GPT or Gemini, right? PH360 doesn't fit into any of those. It's a different class all its own, and that's why we're calling it ambient intelligence, because it takes the learning from foundational AI, traditional and classical AI, generative AI, and public health practice, as well as a lot of other computer science disciplines, and brings them all together to create this system that is an extension of you. One of our big things is that, right, all too often you have systems that you have to learn. You have systems that you have to learn how to prompt engineer if you're doing generative AI, or you have to learn how to code your agent or things along those lines, or you even have to, if you've got an EHR or an EH system, you have to learn about all of those systems. And instead, what PH360 does is it learns about you. And it learns how you want to see information. It learns how you want to use information. You can interact with it in all these different ways. We showed it to you in a web browser, but you could be on a mobile device and you could just talk to it, right? You could take a picture and interact with it that way. So that's why it is a wholly different thing, because it's combining all of these different learnings to really serve the needs of public health.
So another question that we had, Jefferson, and I'll let you answer this, and then Nebu, if there's more that you want to add to this, is how secure is PH360 compared to using an open source AI for public health? And yeah, do you want to start answering?
It depends on how we define open source AI, right? Because there are open source models that you can run locally, right? And those are generative AI models. And sure, those are very secure because you're running them locally, but those are mostly going to be small language models. Those are not going to be large language models. So they're not going to have the power. They're also not going to have the knowledge and the context. And you're going to have to learn a lot about how to deal with models to run them locally. Open source AI is a really, really great tool in research in helping us figure out how we're going to use AI, but really for public health practice, it just doesn't have the power around it. We have really taken security at the heart of Public Health 360 to the point that our first layer is authentication and security. PH360 is fully supports your HIPAA compliance. So if you are a covered entity, our system fully supports that. We are undergoing our SOC 2 audit right now, and we really have put into place the top level security on this thing, because we know that public health can't afford to be on the front page of a newspaper because we've had a data breach. Nibu, anything you want to add to that?
Yeah, absolutely. I'm going to go ahead and assume that there's someone else that asked the question, what about consumer grade AI, and how does the security compare to consumer grade AI, which is what in our research most health departments are using. And when I'm defining consumer grade AI as ChatGPT or OpenAI, Claude, Gemini, etc. And so the short answer is those things aren't secure, and these are secure, especially if you're using the free or licenses. And that is largely due to the specific context that public health departments have, where supporting HIPAA compliance is quite often, and then records retention is also something that's unique to government, right? And so PH360 has both of those. And I will say, if I was at a health department right now, what would keep me up at night is the intern that is using their personal ChatGPT account and somehow puts in PHI because they needed to rush a report to you for a deadline. And that's the kind of situation we want to avoid by taking sort of what I'm going to call a harm reduction approach, by giving people the tools so that they can use them in the way that they need to in order to make their jobs better. Back to you, Jefferson.
Yeah, right. And the last thing that I'll say here is, as Jennifer alluded to and what we talked about, is that we have actually done this and is operational right now in Sauk County, Wisconsin. And we did use PHI information. We processed as part of another project with them. We're not the food code, but we're actually leveraging electronic case reports, and we're able to sign BAAs. Jefferson can talk to you all about that, but just to know that you can ask Jennifer more questions. So anyway, thank you for just letting us brag that. So okay, so I think another question that we're seeing here is some of the concern about our security and our architecture. So Jefferson, I'm going to sort of punt this over to you, but there's rapid augmented generation, which is one of the layers that we have as part of PH360, which is the creation of that back end. But how does PH360 and this idea of ambient public health and ambient technology differ than just using chatbot? And how do you sort of take into account also some of the concerns about combining all health department staff interactions together? So I get maybe those are two separate questions. So maybe answer the first.
Yeah, no. And I may actually have Brett answer the second part of that about how we do, like the thought of using multiple health department staff interactions together. But let me talk a little bit about RAG and what is different here. So RAG is one part of one layer that your request goes through in our system, right? And what RAG does is it looks at a knowledge base and it takes it in and it tries to find a good set of answers, and it gives the model, the foundational model, the context that it needs, right? And so you could have just a normal chatbot with RAG associated to it and it would perform okay, right? It would probably get you to that 86% that Jennifer said, maybe a little bit lower, probably 80%. But what our system does is it not only takes that RAG and makes it contextualized, but it also takes your chat history. It says, what have you talked about, right? What have you been interacting with? It also takes in not just things from a knowledge base, but we're also ordering the way that that knowledge gets to the foundational model so that it's logical, right? Because normally you would have to learn that I need to do a certain prompt in a certain order to get the response that I want. You don't need to do that in PH360 because we want it to be an extension of you. We don't want you to have to think about like, oh, what order do I need to put this in? No, our system figures that out for you. Then there's the addition of the guardrails. So the guardrails are what make it reliable and consistent. So it's going to compare the answer that it got to all of its historical answers and some answers that we give it, so that it makes sure that you're getting consistency. Everyone in your health department is getting consistency, so that if you ask the same question as the person next to you, or if you're in a remote department, the person halfway across the county from you, you both are going to get the same answer, because we need this to be reliable. We can't have hallucinations in public health. It just doesn't work. And that's what the guardrails help us do. So all of those layers work together in tandem to make Public Health 360 as reliable, as consistent, as safe, as secure as we need it to be in public health for the job that we have to do. So that's on the security side. But I don't know if you have any thoughts on why Public Health 360 we corner off this space of Public Health 360 for each health department, but this idea of teams within PH360, how we construct teams and what gets shared between them and why that's important.
Yeah, I think if we take the example of those county ordinances you have and just building your own custom chatbot related ordinances, not everyone has to build it. You could build it one time, share it with your entire team. They all have access to it. So again, it provides that layer of consistency because they're all referencing the same chatbot. So that's just one example. Creating teams, sharing these chatbots across your teams, and how it can ensure consistency and also give them the answers they need quickly.
Yeah. So that team concept is super, super important because we recognize, right, like we're all, public health is a team sport. We don't do it on our own.
So another question that we've gotten in the past, and please, if you have more questions, please keep them coming, is around implementation. So that, right, implementing new technology can oftentimes be a lot of work and can be really hard. So what does it look like to actually implement something like PH360, or what is it to implement PH360? So Nebu?
I'm going to steal from Jennifer here. It really depends on your health department. We are ready to support you in whatever fits best for you. So how we do our implementations is we come and do a little bit of discovery with you. Like, what specific use cases are you interested in? Do you want to go big bang for your whole health department? Great, we can support that. Is it something similar to the food code use case where it was just for the environmental health team? Great, we'll support that. But I think some advice from Jennifer may be instructive here. She says, start small if you need to, pick your key staff, implement the tool, see the results, and then expand. And I think that's good advice. Sorry, Jennifer, I don't know if you're still on. Sorry for stealing your thunder there for a second. But I think that's actually very good advice. These are new tools to many of our health department colleagues. So starting small of interest, but more importantly, it's not about the small, it's about people who are enthusiastic about the tool, that are willing to be champions of the tool and use it to innovate. And Jefferson has this saying where he says, public health is the MacGyvers of government, and we can't wait to see what people do with this tool once it gets into their hand and the assistance they're going to build or the ways that they're going to integrate into their workflow. We're actually very excited about that. Back to you, Juliana.
The one thing that I'll just add to what Nabu said is we're not talking months. This is not a months or a year-long deployment cycle. You sign a contract, you will have your tenant spun up in days. And the requirement, the discovery piece is really the change management. It's making sure that everyone's ready. It's not the technology that needs to be adjusted. It's making sure that everyone is equipped appropriately. So most day, I don't know, Brett, I think it was you who shared an article about implementations, and that the recommendation is, well, you have to have a consultant there, right? And those consulting engagements often take months, and even then, not guaranteed successful, right? Like, they could fail at the end, whereas ours is days. So.
Great, thank you. So what would you say to folks in terms of like, why is this something that is actually important for public health right now, given everything that's going on? Why is making investment in PH360 important, but also even beginning to think about like intelligent ambient public health? Like, why is now the right time?
That's a good Brett question.
I think what it comes down to for a long time, right? So public health is always asked to do more, like take on a pandemic, even though you don't have systems. There's no funding for you, but make it work. It's constantly like that. And I would bet it's not going to get better anytime soon. And so I think there's a workforce that is asking for help. And when they don't get it, it creates issues of turnover. And if you have more turnover, of course, that just puts more load on everyone else who remains. I really feel like from the perspective of someone who's managed staff, if I could give them a tool that not only makes them more effective, but also makes them happier, that is just such a big win. And I think that's really what we need, something like that right now. So that's my answer.
Thank you. So another question that we got here is there a way to give certain access to certain things? Like only food inspectors would have access to a food code and an admin can adjust the files that they're given access to? Absolutely. We have a concept of having different teams. And so, right, you could have your environmental health team, your maternal child health team, which have access to different bots, as well as, because the tracking is so incredibly important and keeping that audit trail, right, where only certain people are able to see what questions have been asked, but then you have that complete audit trail. Yeah, Jefferson, I don't know if there's anything more that you want to add on that.
That was perfect.
Okay.
Julian, there's a second part to that question. I think it's important where can you adjust the files that it wants to draw from is how I'm reading that. So Jefferson, would you address that?
Yes, but you can, right, that's part of that living library is when you are developing your AI assistants, part of that configuration is to choose what parts of your living library you're going to pull from. So whether you're going to pull from our underlying knowledge base plus some of yours, or you're going to pull from only specific parts of your living library, those are all pieces that you would configure in the Innovation Studio as you're creating your AI partners.
Thank you. And then another great question we got is, do we have plans to add some level of analytics to the prompt logging to be able to prioritize training, outreach, and policy development? Absolutely. So that's part of the benefit of organizing things on a team level, so that you can go into our Birch admin portal and be able to look at a whole sort of like, what are the questions overall that are being asked, but also of the food code chatbot. Are a lot of people asking questions about temperature of food on your team? Okay, that is clearly a thing that then you need to do more training about, because there's a lot of questions about that. So that training side of thing is something that, based off of our experience working in local health departments, we felt would be really important to give you that analytical insight. Well, of course, everything is logged, right? There's sort of a dashboard that we have there. And that's something that we see as being a real feature of this, is getting that high level insight into the sorts of questions that your team is asking. So another question that we got is, so we've procured PH360. What does the ongoing support look like for this?
Nabu, do you want to talk about that, or do you want me to?
Oh, sure. I'm happy to. So yes, ongoing support is very important. We offer 2 levels of support, Premier and Signature. Premier is, the main difference is the availability during business hours versus 24, like weekends as well. And so Signature offers you a higher level of support and access to us. We are also available, happily can integrate with your help desk if that's of interest, and can work with your IT staff to do that. Both tiers of support do include upgrades and product maintenance and things like that. So that's how support looks.
Thank you so much, Nabu. All right, another question that we had, and we're coming up on time here, but I'm loving the questions and the discussion that we're having. So do you envision the use of this tool at the federal level? So Jefferson, I'd love to get your perspective on this holistically.
We would love nothing more than for the federal government to be able to use this. I mentioned that we support HIPAA compliance. We're going through our SOC 2. The next thing we'll do is our FedRAMP. So that'll be the next part of the certification for this platform. We are an economically disadvantaged small business, which means that procurement at the federal level is very easy. But more importantly, right, like our dream, I think, would be that a federal agency would procure PH360 and allow states and locals to use it, right? Whether that is through something like CDC's one-stop front door, or through similar to the ways that we all access Essence, however that might be, we would love to think about that with our federal partners to figure out how to best leverage this system to better public health across the nation. Just the one additional thing about that, while that is a dream, our focus really is on the local level, the local and state level, recognizing that public health is inherently local. Y'all are the boots on the ground doing the work.
Yeah, everyone on our team has come out of the experience of working in local health departments. And so that lived experience of working and volunteering in local health departments really shapes the ways that we build our technology. And so that's something that's really key and important to how we act. So another question that we had is, so say you have an ordinance, right, for going back to the food code example, and it goes away, right? So we have laws change. Imagine that. Is it possible to go back into the builder and to remove it? The answer 100% is that you can do that. Yeah, that is 100% something that we can do. And so, sorry, I'm just going through these questions here to see if there's anything else. So we had a question here also about how might your future integrate community knowledge and better engage community members. So Jefferson, I don't know if you want to talk a little bit about sort of.
Actually, I'm going to pass that to Nabu because he just got through talking. He just got through thinking about this.
Okay.
Wow. Yeah. Well, so what we're hoping for is, I'm gonna talk about community in 2 different ways. What we hope this tool enables is a community of practice, let's say for AI, right, in public health. And the users of this tool will ideally help us build with it together. So like there's the public health community. Now, a big part of AI in general is the biases that come with it, because it's trained on the internet, and the internet is not exactly a sort of diverse view of the world when it comes to the proportion of information. So that's exactly why we've created the ability for you to control the information that it draws from. So draw from authority sources that include a variety of perspectives, and especially in public health needs to be community integrating. And we want to put that control with you to do that. I recently spoke to a person that works with tribal communities, and they were talking about how, like, because of the low level of information that is out there about these communities and where it is captured, a lot of the AI tools don't really speak well to tribal communities. And we agree, and let's go change that together, infrastructure to allow you to do that.
One of the things we talked a lot about how you can use PH360 and ambient intelligence inside of your health department. This isn't just limited to inside of your health department. There's a whole nother side of this platform that can be leveraged to gather community information and engage your community. And that knowledge to then get added into your knowledge base that is, again, your living library, that part, and it's cornered off to you, right? That's not shared with anyone else in the platform, because it's local to your community. And there are several different ways to do that. So if you're interested in that, we'd love to have a conversation about it, because that's a side that we just haven't talked about today. We focused a lot on public health internal work.
Yeah. Well, thanks so much for that answer. So one sort of final question as we wrap up our time, feel free to scan the QR code to schedule a demo with us if you'd like to talk more about what this can mean. But we have sort of one sort of outstanding question, Nebu, just like a little bit more about Flourish and Thrive Labs. If you could talk about us, like, where are we located? Is it something that's actually operational right now?
Yep, let me go in reverse. Yes, it is completely operational because Jennifer's here. So the other part of it is about us. So like Juliana hinted at, we are a company that's for public health by public health, which means that all our employees have lived experience working in health departments that we are very proud of, and that is what we believe you are owed from your partners. We are headquartered in the Grays Lake area, but that is mainly around where our business is registered. We are actually a remote first company with a distributed all across the country. We also have experience working with, like, our clients are state and local health departments for the most part that are, I can say coast to coast, because that is true. We do have someone on the Pacific coast and one on the Atlantic coast, and we work with everyone in between as well. Juliana?
Yeah. All right. Well, I just want to thank everyone for your time here. Thank you so much for coming and dreaming with us. This Thursday, we're having our community of practice, which we invite you to join and be part of that conversation. I'll be sending a follow-up email. And so please feel free to reach out if you have any additional questions. So yeah, thank you so much. You matter. Your work matters. You're making such an impact. So thank you so much.